Hello, sweet doctors. Now it is the final session in neck veins examination. We're gonna end it with a very simple quiz to review all information we studied together. Let's go through the question 1. Causes of prominent A wave in jugular venous pulsations include all of the following except. I'd like to remind you that A wave is correlated with the pressure inside the right atrium, right ventricle. It's related to pressure. So, causes of prominent A wave in jugular venous pulsations include all of the following except pulmonary stenosis, pulmonary hypertension, tricuspid stenosis, aortic stenosis, ASD, atrial septal defect. Pulmonary stenosis, PS, is a pressure overload. Pulmonary hypertension, it's a hypertension, it's pressure overload. Tricuspid stenosis, I told you it's pressure overload. Aortic stenosis causes pressure overload. Stenotic valves causes pressure overload. Regurgitation lesions causes volume overload. ASD causes what? Volume overload, because blood moves from the left atrium to the right atrium, causing elevation in the V wave. V volume. So the answer will be ASD, because the question tells us except, right? The next question. 28-year-old man has a history of progressive fatigue and exertional shortness of breath over the last 6 months. Examination revealed raised GVP. GVP means jugular venous pressure, that seemed to increase with inspiration and sharp precordial sound in early diastole. What is the most likely diagnosis? I say that the case scenario is describing cosmal sign, raised GVP on inspiration. Raised GVP on inspiration. This is a paradox. This is not normal. It's cosmal sign. Cosmal sign, so I'm gonna look for a reason causes increased intracardiac intrathoracic pressure. Sharp precordial sound in early diastole is related to constrictive pericarditis. Constrictive pericarditis. Pericardial knock. So constrictive pericarditis is the answer, because right ventricular infarction may cause cosmal sign, but will not cause early diastolic sound. Tricuspid stenosis will not cause raised GVP on inspiration. Is not one of the causes of cosmal sign. Restrictive cardiomyopathy may be yes, but it will not cause sharp precordial sound in early diastole. So the answer will be constrictive pericarditis. Wow, let's go through tracing. The following neck vein pressure tracing could be corresponding to which of the following conditions? Here we go. What do you notice? Where is the problem? A, C, X, V, Y. A is normal, C is normal, X is normal, V no problem, not raised that much. Y very down. What is The most common and only reason for having a deep Y descent, it's constrictive pericarditis. Constrictive pericarditis. Tricuspid stenosis causes giant A wave. Pulmonary embolism will cause raised RV pressure, RA pressure. So it will cause giant A wave as well. Complete heart block will cause cannon pole A wave. So the answer will be constrictive pericarditis. Constrictive pericarditis causes steep, deep X and steep, deep Y descent. The following neck vein pressure tracing could be corresponding to which of the following condition? Where's the problem? Oh, the opposite. A is okay, C as well. X, steep, deep. V, normal. Y, blunted. Steep X, blunted Y. Blunted Y means that after S2 we have diastole. There is no diastolic filling. Your patient is shocked. Why? Because he has X and Y, so pericardial disease, pericardial disorder, tricuspid stenosis, tricuspid regurgitation, pericardial tamponade, complete heart block. It's pericardial tamponade. It's pericardial tamponade. Yes. The following neck vein pressure tracing could be corresponding to which of the following? Where is the problem? The problem is so obvious. The V wave is very big, very big. So what do you choose? Tricuspid regurgitation. Tricuspid regurgitation is the only one that causes volume overload, makes the V wave is very big. Last question. The following neck vein pressure tracing could be corresponding to which of the following conditions? This is V wave. This is V wave. The next positive wave after V should be A wave. So I have here a very tall and peaked A wave. Very tall and peaked A wave is called cannonball A wave. Cannonball A wave. What is your diagnosis? It's complete heart block because the right atrium is contracting against closed tricuspid valve, makes A wave not big, not giant, it's cannonball A wave. It's very tall and peaked. After that, you have normal A wave. This is normal A wave. How it happened? Some patients experience intermittent complete heart block. Intermittent. For seconds. Syncope attack for seconds due to complete heart block, and then they get back. So I guess this is a case scenario for this. A patient with intermittent, very short, episodic, complete heart block. So the venous pressure tracing showed us this cannonball A wave. So the diagnosis should be complete heart block. My dear doctors, I wish you the best of luck in your career, in your study, in your achievements. Best wishes.